Death is a topic that is not commonly discussed. The truth is, though, that regardless of age, race, gender, lifestyle, everybody is eventually going to die. Now, what I want to talk to you about is being prepared for death. If you have, say, a terminal illness, or you're just very elderly and you're getting toward the end, you know that it's coming soon, and you might actually be a little bit more prepared and knowing what you want. But the younger generation also has to think about it, because not only do they get terminal illness as well, you can have unforeseen accidents, and you may not be able to speak your last wishes. And everybody should be able to die as gracefully as they choose to live. So, what is important and what helps you to outline the way you wish to spend the end of your life is called an advance directive. It is a collection of documents that appoints people and appoints certain medical treatments that you do not wish to have. The Public Department of Aging has a form that you print out that is an advance directive that you can take and you can fill out. It's good to do it with maybe a family doctor, because you want to do it with somebody that you trust and that you know will help you carry out your wishes towards the end. The first part of an advance directive is called a health proxy. It is where you choose a person, usually a family member or a very close friend, that allows you they'll help you at the end. They'll, stand up for you when you can't communicate for yourself, and they'll carry these documents and they'll be able to present them and say this is what they wanted, this is what they did not want. The second part is actually the living will, and this looks just like a little menu. And what it is there's just a list of options, and you choose. There are dialysis, surgery. You can choose if you want invasive procedures or non-invasive procedures, and you don't have to choose them all, which is the part some people get confused about. Then you have a do not resuscitate order. And resuscitation is actually when your heart stops beating and you're considered clinically dead. Do you want efforts to bring you back? Do you want the CPR, and do you want the defibrillation, which is the paddles which will restart your heart? And last, you have an organ donation, and you can choose whether you want your organs donated or not, and then you can choose which organs you want. Now that we've talked about these documents, why is it important? Well, it's end of life care. I mean, many people think about the way that they live, but not the way they die. So you want to think about, at the end, if I can't communicate, do I want to live in a persistent vegetative state? And this helps you outline exactly what you do or do not wish to receive. Because it can be unexpected. So you need to have a plan, just like anything else. The thing about advance directives and talking about deaths is there are many myths that may come about. And actually, the Commonwealth of Pennsylvania has a list of myths and the actual truths that go with them. And some of the most common ones are the fact that doctors must follow these orders. That's actually not true. This is a plan, but a doctor can say that morally they choose to give you a drug that you wish to not have. So it is important to find a doctor that you discuss this with and seems like they'll follow your plan. And if you can't, you may unfortunately have to switch doctors, but you definitely need to discuss it with a doctor instead of just having this document set to the side. Another one is that it is only for the young, or only for the old. Well, that's not true. The Journal of Palliative Medicine published an article that is called How I Wish to Be Remembered, but with the young and adolescent public. And it is a few discussions with younger people and how they have actually filled out advance directives, some as young as 18 up into, like I said, the young adolescents. And they have seen family members die around them, or they have seen, people that they loved in accidents, and they decided that they were going to fill one out by their own. So it is not only for the elderly. Also, that an advanced directive means you get no treatment at all. No, you just get to choose your treatment. Say you have stage 4 cancer and you're at the end and you don't want to prolong your life, but you don't want to die in pain. This is one of the times it really comes in important, because this justifies the fact that the doctors are giving you pain medications, because as most people kind of realize, pain medications do slow down, they can slow down your breathing and they can actually depress your systems a little, so it helps you pass easily. And it's important to have these plans written out so that it happens as you want. You die painlessly in the way that you choose.